right, so let me pronounce your vocabulary for you. Abdominal ultrasound. Abdominocentesis. Absorption. Achalasia. Achlorhydria. I'm skipping that one. Alimentary. Alkaline phosphatase. Amino. Amylase. Fistula. Anorexia. Anus. Aphagia. Aphthous stomatitis. Appendectomy. Appendicitis. Acidic fluid, as in ascites. Atresia. Barium enema. Barium swallow. Bicuspid. Bile. Biliary. Bilirubin. Borborygmus. Bowel. Buccal. Canine. Cardiac sphincter. Cecostomy. Cecum. Celiac disease. Celiac rickets. Chyloplasty, chylosis. Cholecystectomy. Cholecystitis. Cholecystogram. Cholecystography. Cholelithiasis. Chronic polyposis, polyps. Chyme. Cirrhosis. Colon. Colonoscopy. Colorectal. Colostomy. Common bile duct. Constipation. Crohn's disease. Crown. CT. Cuspid. Deciduous. Defecation. Deglutition. Dental caries. No, that's cavities. Dentin. Diarrhea. Dietitian. Digestion. Digestive tract. Diverticular disease. Duodenostomy or duodeноstomy. Duodenum. Duodenum. Dysentery. Dyspepsia. Dysphagia. Emaciation. Emesis. Emulsify. Enamel. Endocrine. Endoscopic retrograde cholangiopancreatography. Enteritis. Enzyme. Eructation. Belching. Esophageal varices. Twisted. Esophagitis. Esophagus. Exocrine. Extracorporeal shockwave lithotripsy. Fatty acids. Feces. Flatulence. Flatus. Fluoroscopy. Gallbladder. Gastrictasia. Gastric. Gastroenterologist. Gastroesophageal reflux. Skipping. Gastrorrhea. Gastrospasm. Gastrostomy. Gavage. Gingivitis. Glossitis. Glucose, glycogen. Skipping over hepatitis, hepatocyte, hepatomegaly, hepatopathy, hernia, hernorrhaphy, herpetic stomatitis, Hirschsprung, hydrochloric acid, hyperemesis, icterus, ileocecal, ileum ileus, incisor, insulin, intestinal obstruction, intussusception, telescoping, IBS, irritable bowel, jaundice, jejunostomy, jejunum, laparoscopy, lavage, lingual lipase, lipolysis, lipoma or lipoma, lithogenesis, lithotripsy, liver, skipping, mandibular, mastication, melena, not melena, melena, molars, nasogastric intubation, nausea, nutritionist, oral leukoplakia, oropharynx, orthodontist, palate, pancreatitis, papilli, parotid, peptic, percutaneous transhepatic cholangiography, periodontal, peristalsis, peritoneal, permanent teeth, pharyngoscope, pharynx, polyphagia, premolar, proctoscopy, pruritus ani, skipping, Rouget, salivary glands, saliva, skipping, sialogram, sigmoidoscopy, spastic, sphincter, steatorrhea, stomach, stomatitis. Stomatitis, not inflammation of the stomach. Stomatitis, inflammation of the mouth. Stomatoplasty, not surgical repair on the stomach. Stool guaiac. Thrush, triglycerides, ulcer, ulcerative colitis, upper GI, urinary bilirubin, uvula, villi, volvulus, vomit, vomitus. So let's see if these work. All right, so Mrs. Jones has had a cholecystectomy and she's gone to an old school physician. So she might be instructed to avoid fatty foods, meats, or sweets. Fatty foods. James has been vomiting on or off. He goes to the emergency room. What might he receive? An antiemetic, a cathartic, or an antacid. Now again, he is only vomiting. He is only vomiting. So therefore, a cathartic is not appropriate. Cathartic, going to make him throw up and going to make him have a bowel movement. So he needs to take an antiemetic. Okay, so which of the following structures is a part of the small intestine? Cecum, sigmoid, ileum. The answer would be ileum. And where does digestion begin? The mouth, the stomach, the duodenum. Duodenum, it begins in the mouth, the oral cavity. And so we have the answers for you. That's wonderful when it works. Now, answers to some of the questions. And also I have a little, on Blackboard, a little thing that you can print out and cut into pieces and rearrange to make sure you know from the oral cavity down through the anus what the parts, the pathway of food. So make sure you know in order those structures. So have a great one.